come in.
Hello, Ms. KR. My name's Jacob. I'm a registered nurse. I'm going to be performing an exam today on you. We're going to be reviewing your head, face, ears, neck, and eyes, as well as gathering some relevant information of these areas. Okay? Let me just go ahead and wash my hands and gather my supplies, and I'll be right with you.
Okay.
Some supplies that we'll be using today will be gloves in certain circumstances. I will have a notepad, a tuning fork, an otoscope with different head covers, a pin light, tongue depressors, some gauze, and we have tape measures as well. First, let's start off by getting some health history. Tell me about your recent health history involving these areas: your neck, your head, your eyes, your ears, your nose, your mouth.
Well, I've had some prescription eye contacts for about 2 years, and I also have 2 piercings on each ear.
Okay. Have you had any head trauma, skull surgeries, fractures anywhere in your face or head?
No, sir.
Okay. Any headaches?
Mm-mm.
Any sinus infection, tenderness?
No.
Okay. Any difficulty swallowing, chewing?
No.
Okay. Do you grind your teeth?
No, sir.
When was your last dental exam?
My last exam was last November.
Okay. All right. And do you floss?
Yes.
Yes. Okay. You have any blurred vision?
No.
No. Do you see any spots, floaters, halos, around lights?
No.
No. Do you take any medication for your eyes? No. Okay. You mentioned you use contacts. Do you share those contacts with anyone?
No.
Okay, that's very good. That's a big risk for infection, and our eyes are very important to us. Do you have any family history of cataracts, glaucoma, blindness?
Not that I'm aware of.
Okay. Any hearing difference in both of your ears?
No.
No. Problems with balance, dizziness, vertigo?
No.
Do you recall your last hearing exam?
It was sometime in middle school, around 2 years back.
Okay. Do you know the results of that test?
The nurses didn't say I had any complications or problems.
Okay. All right. Well, let's go ahead and I'm going to start. First, I'm going to check your head position. Okay. I'm going to check to make sure is your head erect. Is it extended? Is it upright or not? In this case, your neck and head is fine. It's straight and aligned. Is it in the midline? Also, I'm going to check. We should notice that the occipital frontal circumference in children, we might want to measure around the head just to notice if there's any swelling, any difference in growth. Your head right now is normal cephalic. Microcephalic would be an abnormally small head, or macrocephalic would be an abnormally large head. We're going to look side to side to see the symmetry, and right now it is symmetrical in shape. We're going to check for head hair presence. Is this your natural hair?
Yes.
Yes. Okay. Do you color or dye your hair?
No.
No. Okay. You can check for length. This is of medium length and abundance in the quality. Distribution. It's evenly distributed on both sides. The hairline is straight across. No widow's peak noted. Okay, we're also going to check the scalp. We're going to check for infestations of lice. Just checking gently in there to see if you can see any lice separating the hairs. While you're doing this, you're also looking at the scalp for any lesions, which can include capitis, shingles, flakes, crusts, such as dandruff, or even including cradle cap. So here there's no lesions. We're checking the color to make sure that the color all along the scalp is the same. If there's red, if it's red, erythema, You're checking the texture as you're feeling the scalp. Is it same all across? Is it coarse or gritty? In this case, it's coarse. Is it moisture? But right now we feel it's dry. And the temperature as well, all throughout the head. You want to check to make sure temperature feels the same all throughout the head. And mobility. Does the scalp move whenever you're squeezing it? And you're checking for hygiene in the area. Is it cleanliness, in which this case it is. You're asking, do you feel any discomfort when your scalp is moved?
No.
On some heads, you may see on mainly males, may be easier to see, but a crinkly-like thing that would be a cutis verticus grata, which is like a wrinkling-like look of the scalp, and it's not present here. Next, we're going to go in to check the lymph nodes. You're going to check the location, size, and shape, mobility, consistency, if they're hard or soft, temperature, and tenderness. Okay, so we're going to start here, and we're going to check her posterior arcula. Okay. The pre-arcular, the parotid right here below. Okay, tonsillar, just here behind the mandible. Okay, occipital, back here just below the occipital bone. The superior clavicle. The deep clavicle, posterior clavicle, and supraclavicle. And we're also going to check the submandible and the submental. It's the lower lip floor of the mouth, about the apex of the tongue. And those will be the nodes. So they were freely movable. No swelling noted, no injury noted. Okay. So now we're also going to feel for temporal pulses. Okay. Should be able to feel on both sides. All right, I'm going to listen for a bruit. Okay, checking both sides. All right, now we're going to go ahead and move on to the face. First, you always want to observe the patient's facial expressions. And this is also very important that it's culturally influenced. Your eyes contact, some cultures may not want to make eye contact with you. They might have a flat effect. So you have to take that into consideration when assessing the facial features. Facial expressions can give you ideas of the patient's mood, such as anxiety or worried. Faces can also help you identify other problems, such as abuse, Down syndrome, maxedemia, mumps, Cushing syndrome, or Graves' disease. You want to look at the facial shape. Is it round? Is it oblongated? Square? In this case, it's a round, and the symmetry of the face you also want to check. Make sure it's symmetrical in shape, color. Checking for malformations or disfigurements in the face, any tics or spasms, a palsy. Okay, we're also going to do the Chavostic sign, which you begin by telling the patient to relax her facial muscles in this case, then stand directly in front of him or her. And you're going to tap on the facial nerve, either just anterior to the earlobe, below the zygomatic arc, or between the zygomatic arc and the corner of his or her mouth. A positive response varies from twitching of the lip or the corner of the mouth, or to spasms of the facial muscles. depending on the severity of hypocalcemia. So you're just going to tap right here. Okay, so we had no facial movement, so that was a negative sign. Okay, you're also going to assess on the face facial hair. Is it appropriate for the age and gender? Moisture of the skin. Is it dry, oily? Okay, are there any lesions as you're looking through the skin? Any discolorations? In this case here, we have a couple lesions here. They're not raised. Do you recall how long you've had those 3 lesions there?
For about 13, 14 years.
Okay. Have you had any change, any sensation to those lesions or anything like that?
No.
Okay. All right. And you're also going to observe for any discolorations in the face in different areas, maybe from a hemangioma. In this case, there's none. You want to look any facial tattoos, piercings. So we have none. Have you ever had any facial tattoos or piercings? No? Okay. And any edema. And just is there sensation in the face, which will let us know of the cranial nerve 5, the trigeminal. Okay. All right, now we're going to move on to the nose and senses. You want to check the location of the nose. Is it midline? Okay. Of the face, is it centered in the face? The color compared to the rest of the body, it should be the same. In this case, we have a nice bronze color. The nostril size and shape. So you're going to have to get up under here. Can you tilt your head back, please? Okay, so you want to look at the shape of the nostrils to see if they're symmetrical. Also, you want to look into the nose without the speculum at first for foreign objects, and you do not want to push anything more in. You want to observe the skin, hair, mucosa on the inside right now, which we will do. The internal mucosa should be redder than the oral mucosa with hair and moist. You want to, as you're also looking in, you want to observe the septum, make sure if you can notice it's deviated or not. Okay, now we're going to go ahead and look in with the scope. Okay. Okay, and while you were looking with the scope, you want to be looking for any mucosa for drainage or edema, which I didn't see any. You want to make sure you can illuminate the septum. In this case, we could. The color of the septum, you want to know. It should be straight and intact. Also observe the turbinates. Ask about smell. Can you smell anything? Do you have problems smelling at any time? No? You want to check each airs. Can you please blow out one air? Okay, and this one. All right, which they're able to do so easily. This will help you identify the cranial nerve 1, the olfactory. Okay, and you also want to just feel the sinuses. Have you felt any pressure, any pain or discomfort there in your sinuses?
No.
Okay, this is here. You want to look at the frontal sinus, the ethmoid sinus, the sphenoid sinus, and the maxillary sinus is right here. No tenderness or discomfort?
No.
Okay. Okay, and now we're going to move on to the mouth and throat. First, we're going to take the temporal mandibular joint here. Can you open your mouth and close your mouth? Okay, open and close again. All right, so you're trying to feel for any crepitus or any discomfort. In this case, the patient's able to move it. Okay. We're going to look at the lips. Okay, you want to note the color. Are they pink? The moisture, are they moist? Signs that they're not moist, maybe signs of dehydration. Are the ability to close, the symmetry. Is there any edema, any lesions, any jewelry, sensation? Are you able to feel your lips fine?
Yes.
Do you feel hot and cold? Okay. All right. Now we're gonna look at her mucous membranes and her palates. Can you open your mouth, please? Ah. Okay, and you want to check for integrity. Make sure there's any lesions or cuts or anything. You want to make sure there's the moist. You should note various shades of pink inside the mouth. Okay. It should be symmetrical in color on both sides. Okay. You're going to be looking at also at the gums. Here shortly I'll be putting my fingers into your mouth, so I'm going to go ahead and put on some gloves. If it was an elderly patient and they had dentures, you would ask them to remove for this point to assess the gums. You're going to note the color of the gums. Okay. As well, looking for any lesions or edema or any, make sure they're moist. Okay, you're gonna look at the teeth for the color. Open, Okay, looking for any cavities, any lesions, any cracks. Okay, the teeth are here intact. You're gonna want to count them. Adults should have 32. If they have their wisdom teeth removed, then there'll be 28. Okay, so you want to count all the teeth here. Any dental appliances? Do they have, like I said, dentures, fillings, caps, or anything like that? Do you feel your teeth sensitive when you eat? No? Okay. How often do you brush your teeth?
Twice a day.
Okay. Do you floss?
Yes.
Okay. Now we're going to move on to the tongue. Have the client, at this point, we're going to get a tongue depressor ready. You're going to have the client raise their tongue to observe below the tongue. Can you please raise your tongue? Raise your tongue up. Okay. Okay, and then with the light, you can observe the bottom of the tongue there. It should be midline, intact, and fit easily to the bottom of the mouth. A large tongue would be also known as acromegaly. The color should be pink, may have some white coating. Red may be a sign of scarlet fever, irritation, or inflammation. White may be a sign of thrush, debris. Dark can be from something eaten or medication, such as Pepto-Bismol or antibiotic use. Do you brush your tongue?
Yes.
Okay, so you always want to make sure that they brush their tongue regularly. Now I'm going to go ahead and grab with my gloves. I'm going to grab the tongue to assess for texture. It should be rough. Let me see. Can I please see your tongue? Okay. Okay, should be rough. Hair is possible on there. If you see lots of cracks or anything here in the tongue, that could be from it could be what we know as scrotal. You're gonna feel for any nodules there in the tongue as well. You want to ask about jewelry. Have you ever had any tongue piercings or anything? No? Okay. Ask about range of motion. Can you please raise your tongue up to the side? To the other side? Okay. All right, and that's going to help you assess the cranial nerve 12, the hypoglossal. All right, now we're also going to look at the sublingual area, checking for color, vascularity. Can you please raise up your tongue? Okay, all the way up, tongue up. Okay. And we're going to be observing the frenulum, note saliva, the amount, the quality. As I said, like everywhere in the body, we're going to also note if any lesions. We didn't note any at this time. We're going to note the back of the throat. We're going to take a good look into the back of the throat. Please open your mouth. Okay. All right. And when you're looking in the back of the throat, you're looking for symmetry. Make sure it's symmetrical in color, size, shape. The color should usually be pink. Any moisture or discharge from there, any lesions. You're going to want to check the patient's gag reflex. Okay, in this case we have a positive gag reflex there. You're going to ask the patient to swallow. Can you swallow fine? Okay. And as you're doing your assessment and interacting with your patient, you want to listen to their voice and the quality. That can give you a lot as well. Also, when you were looking at the back of the throat there, you want to look at the tonsils. There should be 2 tonsils. The color, is it pink? Is it red? Is it white? Is it yellow? And these can be measured in sizes. +1, the tonsils are visible. 2+, it's halfway to the uvula. +3 plus is touching the uvula, and 4 plus is it's kissing all the way to the back, the tonsils on the uvula. Now we're going to go ahead and go on to the ears and neck. Okay, please turn to the side here. All right, so okay, so first we want to identify parts of the ear. Okay, so we have the fossa triangulis here, up here in the inner ear up here, or the in part of the area here of the ear, not the inner ear. We have the Kimball conchae. We have the crus of helix right here. Crus of helix. We have the tergis here. Okay. We have the cavium concrete, this little pit in here. Okay. We're also going to have the lobe, the antitragus, the antihelix here. Okay. And then we have the actual helix up here. Okay. And then we have this here inside the helix, we have the scaffold fossa. Okay, we want to assess the number of ears. In this case, we have 2 ears. An absence of one could be from trauma or from a congenital defect. Okay, we're going to check the position and location. Again, we want to make sure the ear's on the eye occipital line. So you can just place your hand here at the above of the ear, and you should meet right here at the crest of the eye. The top of the pinna should be above that line. All right, so you want to check the angle, the attachment here. It's the lobe is not here attached to the ear. Angle is straight back. Are they vertical, tilted? Any jewelry? In this case, we do have 2 piercings here on each ear, like she mentioned earlier. Is there any inflammation? Which it would be erythema, would be redness, cyanosis, maybe identifying hypoxia. The ears may turn a light blue. You want to note the size, shape, proportionate to the head. So these are of medium size, proportionate to her head. Consistency, resilience. Okay, so she's fairly young here, so lots of consistency, resilience. You might see that decreases in your elderly patients. Is there any lesions in the ear? So you check around the ears, and we have no lesions on these ears. You want to observe for Darwin's tubercle, which could be a small little nodule right here on the outside of the inside, and it looks like we do have a small one here. If you can get that in closer. Okay, very small one here on the inner aspect of the ear. You want to note the ear for cauliflower ear, which could be a response to repeated trauma by trauma to the cartilage. It's a response by the cartilage. You might see that in boxers, wrestlers, and stuff like that. Is there any furnicle? There's none present at this time. Keloids, which sometimes you'll see here, which also is a response sometimes to the trauma. Now you're going to look into the ear with the naked eye before inserting the otoscope. Okay. And we're looking for any foreign objects. We're looking at the streamen, seeing if there's any discharge or drainage, any lesions that we can see without it. Okay, so I didn't see any foreign objects. So we can go ahead and place the otoscope. And of course, you're going to also note the odor when you're down there. If it gives out a strong odor, there shouldn't be a strong odor. Again, looking at the preauricular and postauricular lymph nodes as we did earlier. So as you're there, we've already checked these, but that's a part of the ear assessment. You want to notice these nodes right here. Okay. You're also looking at the ears. Are they symmetrical, size, shape, color, texture? All that should be the same on both sides. Do you have any pain to your ears, ma'am?
No.
No? Okay. The ear canal is approximately 2.5 centimeters in length. And you're also going to be noting hair growth. Okay, so right here, just some very little fuzz there. No long hairs or abundant of hairs there. You want to notice any edema. In this case, there was none. Do you use hearing aids?
No.
No? Okay. Okay, now we're going to observe the ear with the otoscope. So as I get that ready here. Okay, you want to hold the scope up and away, and support it between yourself and the client's head, because you don't want to cause an injury. Okay, so you're gonna as you're preparing, you're gonna let the client know what you're doing. You want to protect the client from injury. Can you please tilt your head towards that opposite shoulder? Okay, thank you. And you're gonna keep a handle horizontal or diagonal. You're gonna grasp the pinna and firmly but gently, so you can raise and straighten out the ear canal there. And again, we're looking for drainage. We're looking at the streaming. Is there an excessive, abundant amount? Okay. So as we're looking in there, we want to also observe make sure there's no foreign objects, like I said. And we're going to also observe the tympanic membrane, which marks the lateral limits of the middle ear. This should be intact, shiny, translucent, a pearly gray color, in which this case it was. We may also observe a few vessels in there. And also you want to look for a cone-shaped reflection of light. It appears as the anterior-interior quadrant. Also the color should be a pearly gray, like I mentioned. Integrity, was it intact? In this case it was intact. And you're going to do the both for both sides. Okay, so the tympanic membrane, was it bulging? Was it retracted? Any scarring? Does the patient have sensation in the ears? So we're going to go ahead and check this side as well. Okay. Please tilt your head that way, ma'am. Thank you. All right. All right, so you're going to check for ear sensation. Were you able to feel everything when I was touching on your ear fine? Yes? Any pain or discomfort during that examination?
No.
No? And also, as you're interacting with them, you want to, pay attention to their hearing. Are they asking you to repeat a lot of questions? And that's, as you're carrying on your assessment, you can continue that. So, have you had any difficulty hearing recently?
Mm-hmm.
No? Okay. All right. Now we can go ahead and remove our gloves. Now we can go ahead and use some hand sanitizer in between, since our hands were not visibly soiled, or the gloves were not visibly soiled at that time. Okay, now we're going to focus on hearing. This deals with the cranial nerve 8, which is the auditory acoustic. Like I said earlier, note the client's response to conversation throughout the assessment. First, we're going to do the Weber test. The Weber test tests for lateralization. Okay, so you take your spooning fork, you can hit it against your hand, and you're going to place it right here in the center of the scalp. Okay, and they should be able to hear the vibration on both sides once you place here in the center. And this tests for lateralization. All right, now we're also going to go on to assess conduction and air conduction with bone conduction. Air conduction and bone conduction, the air should be about twice as long as the bone conduction. To check this, all you're going to do is you're going to hit your tuning fork. Okay, you're going to place it behind here the ear. You're going to ask them to tell you when they no longer hear the noise. Okay, and then they'll tell you they no longer hear the noise, and then you move it here in front of the ear, and they should still continue to hear it, and it should be twice as long as when they were able to hear it from the bone at the back. This is the Rhines test. You want to use a tuning fork of at least 512 hertz, so you can perform this part, which is the Rhines test here, which we're assessing the air conduction with the bone conduction. If it would be positive if the air conduction is twice the bone conduction, it would be negative if the bone conduction is twice the air conduction. Also, as the client was arriving, or you want to know equilibrium, ma'am, have you had any dizziness, vertigo, sense of imbalance, or nausea?
No.
No? Okay. You want to watch for swaying, loss of balance, stumbling when the patient's there with you. Okay. Now we're going to go on to the neck. The next position should be extended in midline. Torticollis would be a twisted neck, so you just want to observe from the center of the patient just to make sure the neckline is straight. Okay, you want to check integrity on the neck. Okay, you're looking for any lesions, any swelling, any discolorations, any areas open or broken. Any fat pads or rolls here in the back? Okay. No? Okay. Any scars, hickeys? Better not be any. Um, uh, carbuncles. You want to note the size of the neck. In this case, we have a fairly thin neck. Um, you can have a thick neck, a non-existent neck on some football players. You want to view the trachea here. Please tilt your head back. You want to view the trachea here to make sure it's in midline. Make sure it's not deviated, which could be a sign of a pneumothorax. Our patient today here has a nice midline with. You also want to note, some patients may have a tracheostomy in place to help them breathe. In this case, we don't have one. All right. Now we're also going to go into the thyroid on here on the neck. So on the thyroid, we're going to some key areas here you're going to want to know about is you have the hyoid bone up here. You have the thyroid cartilage. Okay. And then you have the thyroid should be located here centrally. It's sort of tucked in there behind the sternomastoid muscle here. Okay, so the thyroid gland will be right there, and it will also be just above the trachea here. Okay, so it'd be right about in this area here. Okay, so you anatomically know where that's at. You're gonna explain to the client, Miss KR, we're gonna go ahead and assess your thyroid today. Okay, so first I'm gonna go ahead and listen for a bruit. Okay. Okay, and we don't hear a bruit, which is fine because that could be a sign of an enlarged thyroid. Okay, feel a thrill there as well. If they were present, like I said, that might be a sign of an enlargement. Feeling from the posterior approach, you're gonna want to stand behind the patient. Okay, please tilt your head back. All right. You're gonna tell them to swallow with both hands as you reach from the back. Please swallow. Okay. Okay, you should be able to locate the carotid process with the right hand here. Okay, so I didn't feel any enlargement or movement. It's freely movable. Was able to palpate it. It should be small, soft, non-tender, symmetrical on both sides. If it's enlarged on one side and non-tender, or if it's enlarged on both sides and non-tender, maybe a sign of goiter. If it's enlarged on both sides and tender, thyroiditis. If large on only one side, it could be a cyst or a node. So you would want to definitely have that more further checked out. And at this point also on the neck, you may want to go through and check all the nodes again, like we discussed, the pericular, the posterior arcular, occipital, the superficial cervical, the posterior cervical, the supraclavicular, the deep clavicle chain, submental, and submandibular. Okay, now continuing on the neck, we should note 2 carotid arteries, 2 jugular veins. There should be 2 sets of the jugular veins. On the carotid arteries, there are going to be 2. It's between the sternomastoid muscle and the trachea. Please flex your necks back. Okay, so right here. Okay. Palpate the lower half of the neck here. We're going to be feeling for a pulse. Okay. Come to the side as well. Check on the other side. And then we're going to check here on this side as well. All right, I'm going to listen for a thrill or bruit. Okay, and you can check with both sides of your bell. The larger side will be for high pitch and the smaller side for low pitch. So there, I hear it with the low side. Hear it better. All right, so we were able to hear the bruit, and we were able to feel the thrill. And you want to compare the both sides. Obviously, there should be one on each side. If not, we're in big trouble here. Also, we're going to check the jugular veins. There should be two sets. One's the external jugular, which is on top of the sternomastoid. Okay, and then there's an internal, which is under the muscle of the sternomastoid. And you're going to want to try to feel for a thrill as well, like we did already. Okay, can you hear a bruit of that one? Like I said, which we already went through and we could hear. And we use the bell of the stethoscope. And we want to compare those bilaterally. Neck mobility. This will show us the function of the cranial nerve 11, the spinal accessories. Okay, so I'm going to stand behind the patient and I'm going to ask him, can you please move your head to the left against the resistance? Okay. The same over here. Okay. Now, can you please raise your shoulders? Okay. And you just want to be able to see if they can provide equal resistance there, which she could. And you want to notice any crepitus or pain with the movement. Okay. And I'm going to stand behind her and we check the resistance. She was able to shrug her shoulders. So we have no any issues there. Okay. Now we're going to go ahead and go on to the eyes. Okay. We want to note the structure of the eye at first. Let me see here. Okay. Okay, so we're going to want to note the structures of the eye here. We have the upper eyelid here. We have the pupilla fissure there underneath. We have the lateral canthus here. Okay. We have the lower eyelid, eyebrow. We have the pupil, iris, sclera, the white area here. The medial canthus. And you have also there the caruncle. Okay. And when you're looking at the eyes, you want to notice symmetry. You're going to have to get eye level with the patient to make sure they're symmetrical in color, shape, size. You want to assess visual acuity, central, peripheral, and color. And central node emetropia is ideal for their age-related. Hyperopia is farsighted. Myopia is nearsighted. Astigmatism, abnormal corneal curvature. Presbyopia, which is a decrease in the lens elasticity and decrease in accommodation. Okay, in this section here, you can use a Snellen chart to assess vision. We don't have one here available. I'll show you a picture shortly. It's made up of letters. And the patient should stand at least 20 feet away at the level of eyes. The 20/20 should be at the level of the eyes are. And you want to start with the right eye, then the left eye, and then both eyes. And you should complete with and without glasses. In this case, she wears contacts. We wouldn't ask her to remove her contacts if we didn't have somewhere safe to put those. You want to document the line they completed with each eye, such as 20/20, and with a minus. However many they miss from that line. So I'll show you a picture here of that one here. So this is the, okay. That's the Snellen chart. Okay. And like I said, they should be able at least to complete half of the line plus one in order for them to count towards that line. And then when you document it, you're going to put where they were at, 20/20, and then minus however many they missed on that line. Okay. All right. And if they're not familiar with letters or numbers or anything like that, you can go into an E chart. Okay. So it would be like this, and you would ask them to point what direction the E is facing. Okay. So this might be with maybe somebody younger that doesn't know their alphabet yet, or somebody foreign that, you know, is accustomed to a different alphabet. And also you can use the Rosenbaum, which can be used to assess near vision. It consists of numbers. It is held at 14 inches. And again, each eye is checked separately. than together. This is the Rosenbaum. All right. All right. Next, we're going to check peripheral vision. Okay. So 15 to 24 inches away from the client at the same eye level. So I'm going to have to come down here to her eye level now. Okay. So I'm going to have her occlude this eye here. Can you include your eye here? Thank you. And I'll include this one here. Tell me when you can see my fingers.
No.
Okay. And then we're going to switch. The other one. Let me know when you can see my fingers.
No.
Okay. So we're going to be comparing my vision to her vision in this point. Okay. And now also we're going to check the peripheral fields of her eye. Let me know when you can see my fingers.
No.
Okay.
No. No.
Okay.
No.
All right. This eye here.
No. 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 No.
Okay. So we have no issues there with the peripheral vision. Also, we can check for color blindness, and we can do that with the Ishara plates, which consists of numbers of different colors and a circular, and it has colors of different colors in there, like this. I'll show you shortly, and you ask them to identify the numbers. Okay. Now we're going to go on to looking at the eyeballs. Okay, so you want to note the number if there's two. If no eyes are noted, anopia. You want to know if they have any prosthesis, artificial eye or a fake eye for cosmetic reasons. You want to check the position, the alignment. Like I said, consider ethnic or racial traits when looking at the eyes. Are they unilateral or bilateral? Or do they go upward, downward? Again, you're checking the eye occipital line like we discussed earlier from the ear here to the eye to make sure the alignment inside the face. Okay, and then you want to check also on the if the eyes are ophthalmos, which is eyes are out, and enophthalmos, yes, okay, which their eyes are in, yes, eno. Okay, you want to note the shape of the eyebrows. Are they round? Are they oval? Okay, so we have nice round eyes here. Any devices? She had mentioned earlier that she uses contact lenses. Are they corrective or cosmetic? Are these corrective lenses that you use or cosmetic?
Correct.
Okay. Okay, and we're going to want to assess intraocular pressure. Can you please close your eyes? Okay, you should feel a resilience, a bounce back there. Okay. You want to note the eyebrows. Are they natural? Is there makeup? Are these your natural eyebrows and the eyebrow color? Okay. Are they tattooed? Some patients may have them tattooed. You want to note the quantity. It's okay. So we have a fair amount here. They might be absent, sparse, plucked or shaved. Do you pluck or shave your eyebrows?
Pluck. Okay.
And some males or elderly males might have excessive or bushy, or could be anybody. Distribution: the brow should cover the medial to the temporal area here. Okay, so here we have two separate. They're symmetrical. Okay, we're gonna get down and look here across the line. Also, you want to check for lice or nits. Okay, and phthirsis, which is a crab lice infestation in the eye. You can also check for that as well. Okay, now we're going to move into the eyelids. You're checking the position here as well. Like everything else should be symmetrical in shape, color, amount of hair. If present, the color. So she has nice black eyelids here. Okay, evenly distributed amongst both eyes. Okay. And the lids, they should meet when closed. Can you please close your eyes? Okay. In this case, our eyelids meet here when we close them. There should be an opening. The top eye, can you keep your eyes open straight? It should cover 2 to 3 millimeters of the top portion of the eye there, which it does. The superior iris, but not the pupil. Okay. Do lids meet when they close? Like I said, we did. Is there any lid lag? Also known as von Graff's sign. Do they open, close completely? Yes, she was able to do that fine here. If there wasn't, it could be maybe a Bell's palsy, if there's any kind of lower lid droops there. Okay, now we're going to look at the eyelid color. It should be the same as, the rest of the face here, symmetrical on both sides. If there's erythema, it could be in inflammation or cyanosis, if they were blue. Petechiae may use makeup, which we don't see any makeup present here at this time. And you want to check for intactness, any lesions, any bumps, or anything out of the ordinary, which we don't see. You also want to observe them for excessive blinking or tics, peripheral spasms, which may be caused by eye strain, irritation, nervousness, any lesions. Is there any hordeolum, which is a sty, or hemangioma? Could be a discoloration there on top of the eye. Next, we're going to look into the eyelashes, the presence. Are these your real eyelashes?
Yes.
Okay, so there are fake eyelashes, so we want to make sure if they're real or not. You want to check to see if they're scanty, diminished. Is the color real, or is it makeup? In this, we have an abundant amount of eyelashes and no makeup at this point. Okay, you also want to check the direction, which should be pointed away from the eyeball. Okay, if it's rolling excessively out and you can see the conjunctiva there, this would be ectropion. And if it's rolling in, this is entropion. Okay. Also, you want to assess the lacrimal gland, okay, which will be up in here, this portion here. Is there any swelling, any, ask the patient if they have adequate ear production, do they feel dry eyes or anything like that. You have your lacrimal sac right here in the corner of the eye here, and the nasolacrimal duct that will drain here into the nose, okay. So you have the inferior and superior lacrimal papilla. Okay, and it's located on the upper third of the lateral temporal border here. Okay, it helps produce tears, like I said. You want to check for tear production, which could be affected by meds or other health conditions. And you say you don't take any eye medications, right?
No.
Okay. Epiphoria might be too many tears, overproduction of tears. Do you find your eyes watery frequently? No? Okay. And you want to also note the puncta, which there are four. There's one in each medial aspect of each lid, upper and lower, which allows tear drainage into the lacrimal sac and inferior meatus. If it's blocked, obviously the tears won't have anywhere to drain to, and then they'll start coming out here on the cheeks. If the lacrimal sac here is inflamed, it's known as decrocystis. Okay. You also want to observe the conjunctiva. To view the bulbar conjunctiva, you're going to pull down on the lower lid of the eye. Okay. We're looking again for any lesions, any drainage, any redness, any change in color. Here, like I said, evenly pink, no changes in color. To view the palpebral conjunctiva, it's invert the upper lid. Do you want to invert your upper lid? Are you able to? Okay, so sometimes you might want to have the patient do it. You can look here, and again, we're looking for lesions, drainage. Can you do the other eye too, please? Okay. So that one, to me, that's a little bit sensitive there. I don't like anybody really touching my eyes, so usually I prefer for the patient to attempt to do it on their own. If not, you can help them with maybe with a gloved hand, and you can try to help them turn that out. Okay, and there should be no exudate here underneath the eyes, or chemosis, which is swelling or edema of the conjunctiva around the eyes. Okay, and of course, like I said, no lesions. Now we're going to look at sclera. First, we're going to look at the color. It should be white. If blue, they may have marfans. If it's yellow, it could be a sign of jaundice. Red would be bleeding, inflammation. And like I said, this is all the whiting area here. Okay. A rust color may be senile biling plaque. Okay. Now we're going to look at the corneas. It should be intact, transparent, glossy. Okay, so we're taking a look at those. Okay, here we can see that she has her contacts on right now at this point. Okay, and you're going to look at the lens. It should be transparent or clear with the pin light, which we were able to see that it is transparent and clear. If it's opaque or gray or splotch, it could be a sign of a cataract. If it's white, it'd be a retinoblastoma. Okay, now we're going to look at the iris. Okay, in this case, she has the contacts on, so we're not really getting a true vision there of the eyelid, the color. With the contacts, we have a greenish color here with some yellow, so we're not able to see the iris there. But you would want to ask the client, have your eyes changed colors since you can recall?
No.
Okay. All right. So they should be the same color. You want to shine the light from a temporal aspect here to the side. Okay, and you shouldn't be able to see a shadow. A shadow may indicate narrow angle glaucoma. Now we're going to look at the pupil, which is the hole in the iris. It constricts in response to light, dilates to let more light in. It constricts for near vision, dilates for far vision. Okay. You also want to note the size. Should be the same on both sides and round in shape. Response to light should be direct and consensual, meaning that this would be direct. Okay, so you can see it constricts. All right, check the other one. All right. Now we want to see both should do the same. Even though I'm shining a light here, the other one should constrict as well. Okay, Horner syndrome, which would be that it reacts to light and accommodation. Agro-Robertson, it does not react to light, but it does accommodate. Okay, you're going to complete the Hirschsprung test. So you want to stand midline and shine the light at the bridge of the nose. Okay, and you're watching the eyes, how they respond. Okay, this is probably best done here with the dim light. Let me go ahead and dim the lights here for a second. So my light's not that bright here. All right, notice the eyes nystagmus. Okay. And you're noting PERLA, P-E-R-R-L-A, which is abbreviation for the pupils are equal, round, react to light, and accommodation. Okay? And we're also wanting to check here eye movement as well. Okay, can you please follow the tip of this scope here with your eyes and keep your head forward? Okay. All right. Okay. Also, not able to do here with this one, but you can also observe the retina with the ophthalmoscope, noting the red reflex, which should be clear. If splotchy, may be a cataract. Note the optic nerve, which is located to the nasal side. The nasal side here, when you're looking in, you should be able to see the optic nerve. And then after completion of this assessment, you want to make sure you document all your findings with a trusty old pad and paper. Pen and pad. Okay. And you're going to ask, go ahead and document all that, and you'll follow up with the patient.